it is wonderful to have you here and be joined by an EndoFound colleague who's doing tremendous work in the education space with a brand new, soon to be launched project from EndoFound, ENPOWR. Carolyn, welcome.
Thank you so much, Diana. Thank you for having me. I'm excited to chat about ENPOWR and tell you, what we have in the works for launch.
So for those that don't know you, that haven't been at our patient day or the Blossom Ball in the past year, what do you do for EndoFound?
Yeah, I am our senior program manager predominantly for our ENPOWR project, which is the youth education initiative. My background is in public health. I'm a graduate of the Columbia Mailman School of Public Health and have previously worked in a number of adolescent programming. And I'm just excited to be building out this program. We've been working on it for the past year, and we're finally ready to share it with everybody.
So ENPOWR, what is it?
ENPOWR stands for Endometriosis Promoting Outreach and Wide Recognition, and it is our youth-centered educational initiative for right now adolescents in grades 9 through 12, but we hope to expand soon to middle school as well. It teaches everything you need to know about endometriosis, but also about menstrual health, how to recognize signs and symptoms of abnormal menstruation. And it helps us to reach people about the importance of endo and spreading awareness through our volunteer stories in schools.
So what made you become so passionate about being aligned with EndoFound, getting involved in this kind of work?
I think that endometriosis is one of the most important things that I can be working on. There are so many gaps in care, in awareness, in education, and there is so much work to be done here. It also sits at the intersection of a number of other systemic issues, like medical gaslighting and medical sexism. And I think that it's something that requires much more attention and commitment. And I am just excited to be working on it and to be hopefully pushing for greater awareness and education and empowering people to seek care. And
well, with ENPOWR, we know with endometriosis, there is such a delay in a diagnosis, about 10 to 12 years on average. That's a long time to go suffering with pain, not knowing what's wrong with you, and misdiagnoses. How will ENPOWR help tackle that problem by getting into the school systems early and making students aware of what these signs and symptoms of endometriosis could be? What is the main goal here?
We're looking to destigmatize menstruation and endometriosis, but we're also looking to denormalize period pain. There's a sense that extreme period pain is a normal occurrence. It's a normal experience for women. And we know that this disproportionately impacts adolescents. The normalization of period pain can cause adolescents to wait up to 3 times longer than adults with the same symptoms. Adolescents also experience a disproportionate impact of this delay because symptoms for the majority of women in some studies with surgically diagnosed endo, we know that their symptoms began around the time of their first period and intensify over the course of adolescence. So it's really adolescents who are bearing the brunt of this diagnostic delay in a lot of cases. And they have increased subjectability to the stigmatization of menstruation and things like endometriosis, seeking care for menstruation. They also have diminished access to medical care, to information, and that diminished autonomy, just as an adolescent who, can't necessarily bring themselves to the doctor all the time. And so we really want to empower people who are affected by abnormal menstruation to seek care, of course, because we can't diagnose them with endometriosis, but we can give them all the information they need about endo and about abnormal menstruation. And we can give them advice for seeking care, pitfalls that they might come across when they do seek care for endometriosis. And even though doctors and medical providers may not always listen to them in their pain, we can let them know that might happen and prepare them with strategies to address that.
So break down how ENPOWR works. How does it get into a school? How do students access it? How do caretakers access it?
Right. So we have a couple of different dissemination strategies based on, where someone's coming from and whether they have access to certain in-person resources. But in schools and community settings, we're relying on our volunteer endometriosis educators to bring the program into schools and share a little bit of their own story. It's one thing for us to create all of these program materials, but it's another thing to have, somebody in the classroom sharing their story and creating, allowing students to realize the impact of endo, and it helps it to resonate a lot more. For those who can't be joined in the classroom by an endo educator, and for those who are just generally curious, maybe they think they have endo, maybe it's a parent with endo or a parent who just wants to have their child receive the course, we're also making a free and accessible e-course that is going to live on the EndoFound website that anyone can use to learn more about endo and what they can do to get involved and to seek care and whatever they need.
That's incredible, because we do know, as I said earlier on, that early intervention stops, or at least helps prevent that delay in diagnostic. It also helps prevent years of unnecessary suffering, misdiagnoses, and can even help get a control of the disease so the disease doesn't advance and become extrapelvic if it hasn't already. And it really can nip it in the bud, so to speak. So education really is such a powerful tool in helping those with endometriosis. For people who want to volunteer and become endo educators and power educators, how do they do this?
Interested endo educators can go to volunteer.endofound.org to sign up for our all new volunteer hub, and there they'll be able to access volunteering opportunities, events, resources for outreach, for teaching, and all of that. For those who want to sign up their school as an administrator, a teacher, or host a presentation as a community organization, you can also go to endofound.org/empower, and there'll be some sign up your school forms there. If you're not, if you want to volunteer, but you're not comfortable yet, maybe sharing your story with an audience, as is part of the endo educator volunteering, you can definitely also help with outreach, with reaching out to schools to try to book presentations, to find partnership opportunities for the ENPOWR program to go in and interface with youth audiences.
That's great. It's such an exciting time in the endometriosis community, because we're making so many advancements, especially in the advocacy and educational component of things. And as someone who has endometriosis, if I had that conversation when I was 11 or 12, it could have really changed the trajectory of how I was treated with this disease. And I know that that is a similar sentiment of so many people who have endometriosis. So Carolyn, thank you for your passion and for your striving to make the endo space a better place for so many young people.
Thank you. And I appreciate you bringing me on here today, allowing me to talk about this. And hopefully this can inspire more people to get involved with the ENPOWR project, and together we can launch in schools all over the country.